This patient is a 74-year-old lady. She presents with renal failure. She has pain from her hip. She presents also with fatigue. Blood work is being done to clarify what's going on, and the lab work shows that she has anemia. The hemoglobin is just barely over 10. Her creatinine is elevated, and also her estimated glomerular filtration rate is decreased. And these two are clearly linked with each other. Further workup shows that she has high levels of kappa-free light chains in her blood. And that's probably what's contributing to the renal failure. She also has a monoclonal protein in her blood. Many patients present with both monoclonal proteins and light chains. In fact, 80% of patients who have plasma cell disorder would have a monoclonal protein, and the majority of them also do release light chains in combination. Further workup of this patient shows with imaging that there is evidence of lytic lesions, and the lytic lesions are corresponding with the site where the pain is located, which is very typical. This is manifested in this case by lytic lesions in the leg and the hip area where the pain is from. But there also is evidence of lytic lesions elsewhere, and it's also very typical that patients who present with myeloma have manifestations of bone disease throughout the skeleton. Lastly, the patient is worked up with a biopsy of the bone marrow, and it shows a pretty high plasma cell percentage. It's estimated to about 70% by immunohistochemistry. In a healthy person, the plasma cell percentage would be less than 5%, so here we have a much higher number. And it's also confirmed with the immunohistochemistry and the corresponding immunophenotyping by flow cytometry that these plasma cells are light chain restricted. They are kappa light chain restricted, which fits with the blood work showing the IgG kappa monoclonal protein and the overproduction of kappa light chain in the blood. So all these pieces fit very well together. As part of the workup of the bone marrow, FISH and cytogenetics have been conducted, and the report says that the majority of the cells are expressing 17p deletions, which is known as one of the high-risk features. So what we have here in front of us is a 74-year-old lady who presents with classic symptoms of pain, fatigue, and also there is renal failure. And the workup confirms myeloma. I think it's important before we go further into the case to also go over her background history. She has comorbidity, she has hypertension, and she also has a history of diabetes. Both these conditions are being treated and under control, but they will also impact the management going forward, and we need to take this into account if we're talking about treatment and management.